The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and I'm talking to Dr. Andy Sherwood, who's professor of medical psychology at Duke University, and he's studied depression, especially in patients with heart failure, and reports on it in an upcoming issue of JACC. And Dr. Sherwood and Associates studied about 147 patients with heart failure, followed in heart failure clinics with systolic dysfunction, EFs less than 40%. And they looked at the change in depression as measured by the Beck Depression Index over a one-year period of time, followed the patients for 5 years, and then correlated the change with depression in significant endpoints during those 5 years, those endpoints being recurrent hospitalization and mortality. And they found, interestingly enough, for every 1 point reduction in this Beck Depression Index, there was about a 7% increase in risk of these adverse events. An important documentation of the role of depression in heart failure. Now, Andy, I guess one of the first questions that comes up for clinicians is, how do you know that increasing depression isn't due to a deterioration of the underlying organic disease?
Well, it's a very good question. I would say that the both depression and heart failure are complex diseases, complex conditions, and their interplay is clearly going to be very complex, and more research is definitely needed to understand how they are related to each other. In terms of our study, we tried to control for for heart failure disease severity by taking into account a number of factors such as NT-proBNP levels, ejection fraction. We also controlled in the analyses for hospitalizations during that first year, which was the time period over which we're measuring the changes in depressive symptoms. And even controlling for these factors, the heart failure disease itself, we still saw the independent association of baseline depressive symptoms and change in depressive symptoms over time.
Well, now, for a busy clinician in their office, is there some simpler way than the Beck Depression Index to determine whether their heart failure patient is experiencing increased depression?
Well, the Beck Depression Inventory is a 21-item scale. It takes about 5 minutes for a patient to complete. They could possibly complete it in the waiting room and have it available for the physician when they see them. There are other on that scale. We found a 3-point change over a 1-year period to be associated with roughly a doubling of risk. Now, I wouldn't say that the study should be considered definitive in that way, and that a 3-point change would be a threshold to look for. We need more research. But there are other scales that are well validated, such as the Patient Health Questionnaire, which is a 9-item scale that could be completed even more quickly and includes guidelines for the physician.
Great. Now, what about the therapeutic implications? If you detect depression in a heart failure patient, is there anything that you can do that's efficacious in terms of addressing that?
Well, our data suggests that even relatively low levels of elevated depressive symptoms are associated with poorer outcomes. If clinical depression is detected, then ideally one would wish to treat the depression. And the use of antidepressant medication may be one approach that could be considered. However, although there are several approaches to treating depression, such as antidepressants, cognitive behavior therapy, and even moderate levels of exercise have been shown to be helpful, these interventions have not been demonstrated by clinical trials in patients with heart failure, and I think that's really important. So more well-designed clinical trials of antidepressant treatments in heart failure are very much needed in order to provide recommendations.
So we need to be very careful to detect depression in our heart failure patients, although at the moment we don't have therapy of proven benefit. Hopefully that'll be shown in the future. Thanks very much for being with us. For Inside JACC, I'm Tony DeMaria.